Hi there, everyone. I'm so happy to have you, whether you are joining us here today or watching later on the Cure GABA-A YouTube channel. My name is Monica Joanna Alnacave, and I'm the founder and CEO of Cure GABA-A, a nonprofit organization with the sole focus to develop potential therapies for GABA-A variants by partnering with world-renowned researchers in GABA-A and the Organization of Patients for Clinical Trials. Today, we welcome Dr. Gomez, who oversees the Neurodevelopmental Disabilities Program at Children's Hospital, developing comprehensive care for neurodevelopmental disorders with a focus on evidence-based and family-centered practices. Services include specialized clinics for autism and developmental and epileptic encephalopathies, alongside participation in national clinical trials and autism support groups. Under his leadership, the Developmental and Epileptic Encephalopathies Clinic offers multidisciplinary evaluations and advanced interventions for children. I'm handing it off to you, Dr. Gomez. As one of our recommended physicians in our community, we are so excited to meet you.
Thank you for that wonderful introduction. I'm happy and proud and certainly honored to have a chance to share with the Cure GABA-A community and the broader community for developmental and epileptic encephalopathies. As you very well said, I'm in both pediatric neurology and neurodevelopmental disabilities. I'm originally from Colombia in South America. I did my medical schooling back home in Bogota. I relocated to the States 12 years ago. By way of Cincinnati, one of the large children's hospitals in the Midwest. Certainly a very comprehensive and in-depth understanding of the nature of complex and rare disease in pediatrics and through adulthood. I trained in pediatrics over there, and that's where I got a lot of the interest in both the neurologic processes of disease, because I had a chance to work with very many attendings that you guys probably have come across at some point in time, whether it's through Cure GABA-A or just the broader sense of epilepsy care and whatnot, and simultaneously working with folks that have to do with development and neurodevelopmental disabilities as a whole. So I was very fortunate to be mentored by a few folks that have since risen to the top of our field and who were nurturing enough to introduce me to this field of neurodevelopmental disabilities, knowing a little bit of the things that made me passionate about both neurology and development. And up to this year, essentially, we were a combined residency program that was very, very familiar with neurodevelopmental disabilities as a whole, but of very limited access because not a lot of people took to the endeavor of going through this 6 to 7 year training program where you would do 2 years of pediatrics, a year of adult neurology, 2 years of child neurology, and then an extra year kind of dedicated to the neurodevelopmental disabilities aspect. Nowadays, we're doing it as a fellowship to child neurology as well, and there's been some big announcements in some of the larger academic institutions. But I did my training at Baylor, which was one of the large programs along with Kennedy Krieger, UT Southwestern, and a few other places that can tell you a little bit about let's say the spectrum of the conditions that we were always learning and procuring care about and working to better understand, because perhaps a number of the parents that may be listening are familiar with places like Kennedy Krieger and the research within Kennedy Krieger, and of course with Boston Children's Hospital, which had another large neurodevelopmental disabilities program and whatnot. I think I've just been very fortunate to come across the right folks at the right time to teach me and show me the breadth and depth of neurodevelopmental conditions as a whole through the lens of let's say, a longitudinal care approach of care that minds not only the neurological, let's say, the epilepsy care aspects and whatnot, but also the aspects that have to do with integrating into the community, disability care in general, advocacy with governmental bodies, just as much as advocacy with the school bodies, and other aspects of simply figuring out the why and exploring the why. We had a very large program for this purpose at Baylor, and I linked up with a couple of individuals with whom we worked not precisely or specifically in GABA-A conditions, but certainly in other developmental and epileptic encephalopathies and neurodevelopmental disorders. We've had a chance to carry on a lot of research into certain conditions that may be other names that have shown up. I know we We spoke briefly at some point in time about SYNGAP1 being one of those that we've worked on at some point in time, but a little bit of everything that you start to find that the world of interest is kind of as expansive as joined together by the interest of the parents and in the interest of the researchers and clinicians that work with. The one thing, though, that brought me to Florida ultimately, all of this beautiful level of care and all of this fantastic opportunity in research is incredibly lacking in South Florida, in Florida in general, but in South Florida being such a large urban area. And as a Colombian at heart, a South American, a passionate Latin American and whatnot, moving or relocating south as close to home as possible and serving a community that seemed as close to home as possible, both, say, ethnic and cultural familiarity, but also with a lot of the social nuances and difficulties that were met. And the capacity to build a bridge with the actual Latin America region is what ultimately inspired me to move and try and develop. I am thus, as I mentioned, a neurodevelopmentalist by training. I've done clinically with developmental disabilities as a whole, and I think perhaps one of the areas in which I've had the most opportunity to make an impact in South Florida has been in autism care. Because of my experience at Baylor and my trajectory with the folks with whom I was lucky enough to work, one of my greatest passions is really figuring out that why component in many cases, and especially in cases where you have mixed conditions, where it's not only autism or not only developmental delay or hypotonia and whatnot, but you start to find difficulties such as epileptic encephalopathies and whatnot, and have a lot of potential for research and for collaboration with other institutions. I'm currently at DiMaggio Children's Hospital, which is one of the two major children's hospitals in South Florida. We're predominantly a clinical institution. That means we have some academic capacity, but we really are here to serve the community rather than, let's say, serve our academic interests or dependence on academic interests. But we are looking to grow in that capacity and looking to grow, especially to be able to collaborate and become the place where we are able to take on a lot of our children with neurodevelopmental disabilities and developmental and epileptic encephalopathies. And thus, my interest in becoming the director of the program here for neurodevelopmental disabilities, which encompasses all of these, particularly right now, dedicated autism program, dedicated complex autism and complex development clinics. Let's say my baby is really the idea of having a dedicated place for developmental and epileptic encephalopathies. I say developmental and epileptic encephalopathies because a little bit different from what you may have the capacity of doing in places that are a little more let's say, emphatically academic and research-based. There is no capacity for us to simply do, let's say, or exclusively do just one specific neurogenetic condition or another, but rather a place that can become and have all those resources available for a breadth of conditions and be able to provide the comprehensive care, but establish, let's say, the foundation locally and regionally for clinical trials and clinical trial participation, because oftentimes part of the trial readiness means having the capacity to participate in natural history studies, participate in the studies that collect biomarkers, that do other things that allow folks not to have to travel up to the Northeast or travel across the country, or, for example, in the case of folks who may come in from other countries like in Latin America, not have to explore areas where they necessarily understand the whole dynamic. So what we've been developing within the broader neurology department and within the developmental and epileptic encephalopathies clinic has been something of a comprehensive service with neuropsychology, myself as a neurodevelopmentalist, with our director of epilepsy, Cindy Seinfeld, who is, of course, board-trained, board-certified in neurophysiology and epilepsy care. We are able to address genetic and with one of our geneticists we recently hired on from Baylor as well. The idea of having an angle where we're able to care for the epilepsy, complex epilepsies, admit folks to our recently opened 6-bed EMU, or have ambulatory EEG capacities, or have on-the-spot routine EEG capacities, have the ability to determine if we need more developmental testing, which is the kind of care that I do, determine, let's say, on-the-go needs for behavioral care, developmental care. Do we need medications that extend outside of those that deal with epilepsy, or how do we deal with the balance of some of those things? Determine if we need additional tests that are going to play a significant role in some of the clinical trial readiness aspects. So do we need to collect, for example, Vinelands? Do we need someone to be able to collect Bailey evaluations or something along those lines? And that's the purpose of having a neuropsychologist. But also from the clinical perspective, having someone in genetics that can help us figure out what is often a challenge that I trust that you guys have, which is we have a bunch of variants of uncertain significance sometimes, or folks in whom we have a strong suspicion because of the clinical presentation, but the results we get from the genetics are inconclusive or don't lead us to the definitive diagnosis. So trying to be a one-stop shop in resolving some of the difficulties is kind of the goal as it stands. And I think that one of the interesting things that we are trying to offer is a participation in clinical trials that not necessarily focus exclusively or only on things like epilepsy care, even though that tends to be a huge burden. But in many developmental and epileptic encephalopathies, the more you discuss with parents and caregivers and you take in that caregiver experience, epilepsy, especially as children grow, comes to a certain lower level of priority vis-a-vis issues with behavior, issues with development, autism care, or orthotics, or other options that we are able to address during our clinic. So for example, with collaboration with some folks in North Carolina and here at the University of Miami, we've been doing some work on gut-brain axis and changes in terms of GI transit related to symptoms. Specifically right now, we're looking at a couple of different conditions, genetic autism, as well as some conditions that are developmental and epileptic encephalopathy. So, but a little bit of a different gamut of symptoms and a different approach to try and see if we extend a little bit of the care into what has to do with quality of life, what has to do with other aspects that are not exclusively into the epilepsy care. So that's a very verbose way of kind of amplifying a little bit of what we're trying to do. I'm obviously also bilingual, so I'm very passionate about caring for Latin American communities and whatnot. Part of my personal project is also increasing diagnosis and visibility in Latin America. So I collaborate with some of the rare disease and neurodevelopmental disease foundations in Latin America, such as a lot of projects and ideas that are going to spread south into our community as well, and help us locally with our Venezuela and Colombia and Peruvian communities.
Thank you so much, Dr. Gomez. That was such a wonderful biography. As you mentioned, our community understands the importance of a natural history study. And currently, we've taken the first steps by onboarding patients to Citizen and Matrix. Thank you for taking the time to introduce yourself. We are grateful that our patients have the opportunity to work with a physician that is so well versed in epileptic encephalopathies and developmental disabilities, and one that has taken the time to understand how our gene mutations present and the scientific understanding by attending the Cure GABA-A scientific labs. So I am so grateful for you and look forward to our future. Bye.